Have you ever wondered how you can gain better control over your asthma and prevent attacks? It's a question that resonates with many of us, especially those who have to grapple with the unpredictable nature of asthma. Today we're going to delve into this topic, shedding light on how you can take control of your asthma and prevent attacks. Asthma, as we know, is a chronic disease that affects your airways, making them inflamed and narrow, leading to difficulty in breathing. With the right understanding and proactive management, you can lead a fulfilling, active life despite having asthma. Now one might ask, how do I get a grip on my asthma? Well, the first step is understanding the nature of this condition. Asthma isn't a one-size-fits-all condition. It varies from person to person, and so does its triggers. From allergens like pollen and dust mites, to physical exercise and even stress, there are a myriad of things that can set off an asthma attack. Hence, gaining an understanding of what triggers your asthma is important in controlling it. It's equally critical to apply this knowledge in practical ways to prevent asthma attacks. This involves creating a personalized asthma action plan and sticking to it. It means taking your prescribed medications even when you're feeling fine. It means being vigilant about avoiding triggers. These are the small yet significant steps that can make a world of difference in managing your asthma effectively. Your healthcare provider is your ally, ready to assist you in navigating the complexities of asthma. Regular checkups and open communication with your doctor play a crucial role in keeping your asthma well controlled. Stay tuned till the end of this video as we delve into practical steps you can take to prevent asthma attacks. To gain control over asthma, you first need to understand what it is. Asthma is a chronic or long-term condition that affects the airways, the tubes that carry air in and out of your lungs. Picture it like this. Imagine a normal airway as a wide open tunnel, allowing air to flow freely. In the case of asthma, this tunnel becomes narrower, making it harder for air to pass through. This narrowing happens because the walls of the airways swell, the muscles around them tighten, and they produce extra mucus. This results in the common symptoms of asthma: coughing, wheezing, shortness of breath, and chest tightness. Now, what causes this narrowing? That's where triggers come into play. Triggers are essentially things that irritate your airways and cause asthma symptoms. They're like the villains in this story, and they can be as diverse as the people they affect. Some common triggers include allergens like dust mites, pollen, mold, and pet dander. Others might be irritants in the air, such as smoke, chemical fumes, strong odors, or even cold air. Infections like the flu or the common cold can also trigger asthma. And let's not forget about exercise, stress, and strong emotions, which can all play a part too. Now that we have a basic understanding of asthma, we can explore ways to prevent attacks. Preventing asthma attacks involves a combination of lifestyle changes and medical management. Let's begin by discussing the importance of avoiding triggers. Every individual with asthma has a unique set of triggers, which are environmental, emotional, or physical factors that can cause an asthma attack. Common triggers can include allergens like dust mites, pet dander and pollen, irritants like smoke and strong odors, weather changes, exercise, stress, and even certain foods or medications. Recognizing your triggers can be a game changer in managing your asthma. Once you've identified them, it's crucial to make an effort to avoid them. For instance, if dust mites are a trigger for you, consider using allergen-proof bed covers and vacuuming frequently. If smoke is a trigger, ensure you're in a smoke-free environment and stay away from bonfires or barbecues where there might be heavy smoke. Remember, the goal is not to live in a bubble, but to create an environment that minimizes the risk of an attack. Next, let's talk about maintaining a healthy lifestyle. Eating balanced meals, staying hydrated, getting regular exercise, and ensuring adequate sleep are all essential for overall health and can help reduce the frequency of asthma attacks. Exercise, in particular, can improve lung function and reduce inflammation, but it's important to consult with your healthcare provider to determine what kind and level of exercise is safe for you. Finally, it's important to ensure medications are taken as prescribed. Asthma medications are designed to control inflammation, reduce symptoms, and prevent attacks. They can be divided into two main types: controller medications, which are taken daily to reduce inflammation and prevent symptoms, and rescue medications, which are used to quickly relieve symptoms during an attack. It's crucial to take your controller medication every day, even if you're feeling well. Skipping doses can lead to increased inflammation in your lungs, making you more susceptible to an attack. Always have your rescue medication on hand for emergencies. Keep in mind that everyone's asthma is different, and what works for one person may not work for another. Therefore, it's essential to work closely with your healthcare provider to develop a personalized asthma action plan. This plan should outline what medications to take, when to take them, how to recognize when your symptoms are getting worse, and what steps to take during an asthma attack. Remember, the key to preventing asthma attacks is staying proactive about your health. It's all about knowing your body, understanding your triggers, leading a healthy lifestyle, and adhering to your medication regimen. By taking these practical steps, you can gain better control over your asthma and significantly reduce the risk of attacks. While these steps can help prevent asthma attacks, it's crucial not to overlook the role of regular medical checkups. You see, when you live with a condition like asthma, your body is constantly changing. It's reacting to the environment, stress levels, and several other factors. These changes can be subtle, often going unnoticed until they manifest in an asthma attack. But with regular checkups, your doctor can spot these changes early and help you adjust your course before you hit a dead end. Think of your doctor as a seasoned guide who's walked this path many times before. They can monitor your asthma control, looking for signs that your current treatment plan might need tweaking. For instance, if you're using your rescue inhaler more often than usual, it might be a sign that your asthma isn't as well controlled as it could be. Your doctor can then adjust your medication or suggest lifestyle modifications to help you regain control. But most importantly, regular checkups provide peace of mind. They reassure you that you're on the right track, that you're doing everything you can to manage your asthma effectively. They give you the confidence to live your life to the fullest, knowing you're taking the best possible care of your health. Regular checkups are an essential part of maintaining control over your asthma. Gaining control over your asthma may seem daunting, but with these steps, it's entirely possible. Today, we've walked through understanding what asthma is and practical measures to prevent attacks. We've emphasized the importance of regular medical checkups and continuing prescribed medications. But remember, if your asthma isn't well controlled, always consult your doctor for further evaluation. Knowledge is a powerful tool in managing your health. By sharing this video, you're empowering others with the information they need to gain control over their asthma. So, don't keep it to yourself. Pass it on to friends, family, or anyone who might benefit from these tips. Please subscribe to our channel for more health advice. If you have any questions, leave them in the comment section below. Remember, your health is in your hands.